I'm a sleep medicine doctor, which means I practice all the sleep disorders, so people who have trouble sleeping at night or people who have trouble staying awake during the day. And one of the most common disorders I see is obstructive sleep apnea syndrome. And I've become particularly interested in the expression of sleep apnea in women, both its underdiagnosis. We estimate about 90% of women with sleep apnea go undiagnosed, and their symptoms can manifest differently, which is why they don't always it doesn't always pop to mind as a diagnosis when they're probably seeing their primary care doctors. And getting people successfully treated. Sleep apnea affects 24% of men and 9% of women. And as I mentioned, 90% of women go undiagnosed. And so there's really a gap between what we know and how we're practicing it. And I'm interested in addressing that. The kinds of symptoms that women come and present with are not always the same as men. So a man is more likely to report loud snoring and be obese. Women are more likely to report cognitive problems or mood problems as part of their sleep apnea diagnosis. And so it's, for me, what my work is both elucidating the clues that suggest that sleep apnea might be a diagnosis and then finding the right fit for treatment for patients. We know that sleep contributes to our cardiovascular health, our mental health, our cognitive abilities, all of the features of metabolic syndrome like obesity and insulin resistance are all affected by whether or not we're getting quality sleep at night.
So quality sleep is good for all of those, and lack of quality sleep is bad for all of those, just to generalize.
Yeah.
Okay, so one of your patients is sitting next to you, Jen.
So back in 2011, I was finding chasing after my young son was incredibly challenging and difficult. I wasn't getting a good night's sleep. I would be falling asleep on my commute to work from one end of the state to the other. There were times I missed several exits on 295 and I just had no idea where I was. Or I'd wake up or I'd say, I'm almost there, I'm almost there. I'd be trying to keep myself awake. And I finally decided I needed to do something because I have this little person I have to take care of for the rest of his life. So I went and had a sleep study and got the first CPAP machine, which was a big monster box. And from there we've moved forward. I found Katie, and I have a nice quiet machine now, and it just really makes a huge difference. When you wake up in the morning feeling refreshed, you can start your day with a full tank. I began running shortly after that. I became a vegetarian. I began running marathons. I have a whole new life now, 5 years later, 6 years later, but it really did kickstart me.
I'm a registered polysomnographer, and I do both sleep and respiratory. But the story that Jen just presented is very, very common, very typical of what we see here in the sleep labs. So after a patient has had a consultation, has seen Dr. Sharkey, they'll either come into the sleep lab for a diagnostic study to see what type of sleep problem there is. If it is sleep apnea, usually they'll come back to the sleep lab, and this is the treatment part of it. In treatment, it's positive airway pressure. There's a lot of different modes, a lot of different masks, but all in all is, the patient to get her, comfortable, kind of fit them. We don't just say, okay, we're going to put this on you and go to sleep.
One size does not fit all.
And you don't always get it right on the first try.
No, not at all. It's an introduction and habituation to this. You want to take your time and really do it in small increments, because a lot of it is the comfort. And if you can get that patient, like Jen, to be comfortable and be acceptive to that therapy, then the compliance and the therapy to be, it's a win-win for the patient, for the doctor. It's just a win-win for everybody.
And that's what I say all the time to my patients is, they come in, they're snoring, their bed partner has said, I can hear you stop breathing when you sleep. I say, it's not like I'm Dr. House. What could this possibly be? It's probably sleep apnea. And so part of the challenge with my work is to try to find what's the best mode of therapy for what person, to try to make, I think of myself as doing behavioral health as much as sleep medicine, because it's a big change to now have to wear this mask every night before you tuck in, and you're not going to be perfect. People with diabetes, they have a slice of cake sometimes. People with sleep apnea sometimes sleep without their machines, and so it is the relationships that I hope to build with my patients are ones where we're all doing our best, and if we didn't find the right mask, okay, well, then we're gonna, tack the boat in a different direction and see if we can find the right one. If you got off the habit because you had a bad cold or something like that, how are we gonna mitigate that so that you can get back, going for something that is it has to be a long-term treatment. And that's when you were talking about this before, it would be so nice to take a pill and then just call it a day, but
it's not.
It's a process, but you got to stick with it. I mean, just one night, every night that you do it is a night that you're giving yourself. It's a gift you're giving yourself. When you wake up in the morning and you're not exhausted and you're not falling asleep, and in the middle of the day you're still able to function and you feel like you're on top of it, that in itself just, you're important, you're worth it. You need to do it every night.
And you need to forgive yourself on the days that you didn't do it and say, all right, tonight's the next, I'm going to try again tomorrow, or, I'm going to figure out a way to get back with this if I've gotten off track with it. Because I do see a lot of patients where they've quit and we just need to get them kind of going again. And they're reminded then, like, I feel better when I treat my sleep apnea.
You have done sleeping. Yeah. I just think that's the goal. To feel like you wake up and I'm done. I'm actually done.
Right.